today. My name is Denise Stavanish. I'm the owner of DMD Health and Safety Training Services. I've invited Claudia Cometa to talk to us about a very timely topic, the flu. Thank you for joining us, Claudia. Can you tell us a little about yourself?
Yes, and thank you so much for having me, Denise. It's a pleasure being here with you. My name is Claudia Cometa, and I am a pharmacist by profession. I actually currently have a patient advocacy business that I focus on full-time. So although my background is pharmacy, my full-time position is as a patient advocate business owner, where I spend my time advocating for patients and helping them navigate the medical system.
Thank you. So Claudia, what is the flu and what are the symptoms?
I'm so glad you asked this very basic question, because it's so important to first understand what the flu actually is and what it is not. That's important as well. So the flu is actually a virus. It's the influenza virus. It's not a bacteria. And the important part of distinguishing those two is the way that they are treated. So when it's a virus and not a bacteria, we do not use antibiotics. So it's a common misconception that as soon as we start kind of feeling, down and out, we seek out a physician's prescription for an antibiotic. But when we're dealing with the flu and other viruses, we don't treat it that way. It typically resolves on its own, or there are actually antivirals to treat it, but we do not use antibiotics. The symptoms typically start with sore throat. You can get pretty high fevers. You also will typically experience some of the typical cold symptoms. So like runny nose, cough. You might have some muscle aches and body aches. Typically that's kind of the hallmark of the flu. And some people have some atypical symptoms. So some people may actually experience nausea and vomiting and possibly even diarrhea.
Thank you. So what exactly does the vaccine do and how is it developed each year?
This is also super important to understand, as well as we understand and think about which years we have super effective vaccines and which years we don't. So the flu vaccine is actually developed each year looking at the surveillance data of the flu virus strains that are circulating in over 100 countries. So there's actually an advisory committee that tells the FDA, here's what we're seeing out in the community. And every February, the FDA decides on what strains they're going to put in the vaccine to protect against the most common flu vaccine strains or flu strains that they expect to see that upcoming flu season. The way that it's actually made is they incubate and basically create the strains in hen's eggs, and then they kill and deactivate that virus so that you've got these deactivated sort of pieces. And when it is injected into the human body, we actually create antibodies against what your body is seeing. So we create antibodies against it that will help us protect against if and when we are exposed to the actual virus out in the community.
Oh. Why is this year's flu strain so bad, and what can people do?
So this year's common flu strain that you're hearing is being, kind of in the news, and what you've heard is really kind of a very fatal strain, is actually H3N2. And you don't have to know too much about the details around that, but that's the exact strain that is causing the problems. And that strain is a problem because it can mutate. That specific type of flu virus, we know just historically when we've had H3N2 circulating in previous years, that one specifically is more resistant to the flu vaccine and typically mutates as it is transmitted through humans. And so it's harder and harder for those antibodies that we've created based on the flu vaccine to combat it, because it's changing and it's becoming basically more resistant. And so it's a really tough strain to prevent against using just the vaccine. Now, it's important to know that this year's vaccine is quadrivalent, which means that there's 4 strains in this vaccine. There's 2 influenza A types, that's an H1N1 and an H3N2, and there's 2 type B strains in it. And so we do have the ability to protect against H3N2, but the problem is that particular virus typically mutates, and it's really hard to get great effectiveness from the vaccine against that strain. So what do we do about it? even though the vaccine maybe does not appear to be as effective this year as it has been in prior years, it's still really important to get the vaccine. And here's why. Because you may still be exposed to other strains. You might still be exposed to an H1N1 strain, and in which case the likelihood that you'll be well protected is pretty high. It's just that H3N2 that's a problem. Other things that you can do are let your doctor know as soon as you start noticing symptoms. We do have antivirals such as Tamiflu that can be very effective, typically even more effective if taken within 48 hours of symptoms. Of course, try to stay away from environments that would be, kind of heating beds for the flu to be circulating. So that would be, hospitals and nursing homes, if you at all can. Certainly, if you can't, protect yourself, wash your hands, be very cognizant of what you come in contact with and protect yourself and your family in that way. But I definitely still recommend that you get the flu vaccine and protect yourself and your family.
Thank you so very much, Claudia, for this very relevant information. For everyone, please stay tuned for more educational videos from us here at DMD Health and Safety Training Services. Thank you.
Thank you.